Hello everyone, once again welcome to the Nursing Guru. I am nursing tutor Chandana K, and today I am going to explain about the upper respiratory tract infections. It is one of the common viral infections. It may be resolved within 7 to 10 days. Means if anyone has got these problems and all, means it will be resolved very fastly also, means within 7 to 10 days. If you are coming to the parts, means it is the sinuses, pharynx, larynx and trachea, bronchial tube and the alveoli. Okay, if you are means these are the parts which comes under the upper respiratory tract. If anyone has got problems in this part and infections and all, if considered the upper respiratory tract infections. Okay, if we are coming to the disease conditions, first one is the rhinitis. Rhinitis means it is an inflammation of the mucous membrane of the nose. It might be caused because of virus, bacteria or any allergic problems. Okay, and means who are all got problems and all, it will becomes an effect to the our mucous membrane. Okay, who are all got the rhinitis and all, they might be feel that one stuffy nose, runny nose and fever, headache and all. Okay, this is about the rhinitis. Next, go for the sinusitis condition. Sinusitis means inflammation of the paranasal sinus. Means it might be caused because of virus, bacteria or allergic rhinitis. Okay, and next go for the, if who are all facing that sinusitis problems and all, they might be feel facial pain, stuffy nose and difficulty sometime breathing also. Next, come to the next disease condition, tonsillitis. Tonsillitis means it is inflammation of the two oval shaped pad of tissue at the back of the throat. If we are saying in the simple way, means it is inflammation of the tonsillitis. It might be cause of the virus, bacteria. Bacteria means group A, streptococcus bacteria. Who are all facing these problems, they might be feels sore throat, difficulty in swallowing. Next disease condition is the laryngitis. Laryngitis means it is an inflammation of the voice box. Another definition is the inflammation of the larynx. And it might be caused because of the virus or bacteria. Okay, and who are all facing these problems, they might be feel sleeping difficulty, impaired voices as well as the fever. Next one is the epistaxis. Epistaxis means it is the nosebleed. It might be caused because of rubbing the nose or pricking something inside the nose. If you are going to the overall management about the upper respiratory tract infection is, first one is the according to causes. What might be causes, on that basis they will be start with the medications. If they are bacterial infection, they will go for the antibacterial medications. If they got because of the viral infection, they might be go for the viral medications and all. And if they are having the pain, they will be give the analgesics medication for the patients. And along with that, they have to be take the more water. That would be very helpful to that person who are all facing that problems. Let's go for the overall management of the upper respiratory tract infections. Okay, if they got the because of the bacteria, they will be give the antibacterial medications, and taking the fluids is the very important to that problems and all, and as well as the gargle with the warm water with a pinch of salt, that would be very relief for the throat areas, as well as the antipyretic is the help to relieve the temperature of the body of the patients. Let's go to the last part of our session, that is the summarization, means what we discussed today. We have discussed what is the meaning of upper respiratory tract infection and which are the part will becomes under the upper respiratory tract, as well as which are the disease condition is there in the upper respiratory tract infections. We have discussed some more topics, that is rhinitis, sinusitis, laryngitis, tonsillitis as well as the epistaxis. If you have any doubt regarding the topic, just comment in the below, as well as just do like and subscribe our channel. Thank you.